Hello, this is Dr. David Green, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is simply the basics of sciatica. What is sciatica? Sciatica occurs when one of the nerve roots of the sciatic nerve are pinched. Now you can see here, looking at the sciatic nerve from the front, that it's a conglomeration of three nerve roots, L4, L5, and S1. Those come off the spine, they come together, boom, you have the sciatic nerve. Now, 1 to 2% of the population is suffering from sciatica at any one point in time, and most commonly it occurs from a herniated disc or from spinal stenosis. Now, less commonly it can occur from a tumor pinching on the nerve or nerve root irritation from degenerative disc disease, we'll show that in a minute, or any kind of other problem that can occur down here in the leg, okay? Well, how does it work? When a disc degenerates, the outer layer may tear and part of the inner jelly can squeeze out. So you can see that here. You have what should be a nice elliptical arrangement here, okay? Now, through degeneration, this part can get a tear in it and the inner jelly can squeeze out. And it can pinch on the adjacent nerve root. In and of itself, that's not painful, okay? But it can cause motor weakness, where you have a foot drop, difficulty lifting up the leg or whatnot. Then inflammation can get sparked up, and that's where you get sciatica pain, and it can shoot down the nerve root. Now, having said that, what that means is even if there's no jelly that's squeezed out, if there's just some tearing, it can actually spark up inflammation with degenerative disc disease and cause irritation. That's called a chemical irritation of the nerve root. So what are the symptoms? Well, they're going to vary from patient to patient. Not everybody walks right out of a textbook. It might cause some burning sensation, an electrical type feeling, or pins and needles. It may cause frank numbness. A person may have motor weakness. It's not big time common, but it happens. A person can have difficulty lifting up their foot or their leg, and rarely a person can get incontinence. Well, how is it diagnosed? It's usually a combination of patient history, physical exam. Here you have a practitioner doing a straight leg raise test with the leg extended, and what you end up having is severe pain because it pulls pressure, tension on the sciatic nerve, okay? And usually it causes severe pain, and then the knee gets flexed and it goes away, all right? Now, you can also get an MRI to confirm it, and what you see here is a look down on a disc and a large disc herniation coming out and pinching on the area around the spinal cord and the nerve root as it tries to get off of the spinal cord. If it's still unclear, a nerve conduction study can be performed to see which nerve root is being affected, and it may be necessary to do a diagnostic injection to see if it provides relief. Now, what are the treatments for sciatica? I know this is a long list, but let's just run through it. Limited bed rest. Used to be people would stay in bed for a week. What they've shown is that anything over 48 hours is actually more detrimental. Medications may be anything from nonsteroidal anti-inflammatories over the counter to muscle relaxers like Valium to neuropathic medications or opiates for short-term pain relief. Physical therapy and chiropractic treatment can be very beneficial. Here you see an example of a TENS unit, which involves placing foam pads on the skin and slight electrical impulses going through for pain relief. Acupuncture can be a great treatment for spasms and aching. Spinal decompression therapy involves intermittent spinal traction, which can have over 85% good to excellent results when a person is having sciatica. And then what you see here, interventional treatments with an epidural injection, which involves putting steroid around the pinched nerve root and bathes it with soothing steroid medication. Trigger point injections can be very helpful for relieving spasms as well. Well, what are the outcomes with sciatica treatment? Over 95% of patients are able to be successfully treated without surgery. There was a study back in 2006, large study, looking at the one-year outcome between those who had an operation and those who didn't. The outcomes at 1 year were identical. The patients who had surgery were able to get back to work faster and get rid of their pain faster, but that didn't result in a better long-term outcome. There are 3 indications for sciatica surgery. One is absolute. If you have cauda equina syndrome, which is pinching of the spinal cord remnant by itself, it can cause bowel and bladder incontinence, and it can end up being permanent. So that is when a person should have surgery within 24 hours. A relative indication is when a person has motor weakness, such as difficulty lifting up the foot or lifting up the thigh. It depends on which nerve it's being pinched, but that needs to be followed very closely because it may become a situation where after a certain period of time, it doesn't get better no matter how well the surgery is performed. So most people say 6 weeks to 12 weeks, you really should think about doing the surgery if it doesn't get better. Also, if the neurologic injury is getting worse, motor weakness is getting worse, that's an indication for surgery. And then electively, if you have all these treatments like chiro, PT, epidural injections, if none of it's working and the pain is just ridiculous, then 6 to 8 weeks of that, it's indicated to go ahead and do the surgery. The top pain management clinics in Arizona are Arizona Pain Specialists. They have 5 locations throughout the greater Phoenix metropolitan area, including Scottsdale, Glendale, Chandler, Phoenix, and Surprise, Arizona now. Comprehensive treatments with chiro, PT, medical management, as well as interventional treatments by the pain doctors. They take over 50 insurances. They're all board certified, and they won the Patient's Choice Award 5 years in a row. Call today at 602-507-6550 and check us out on the web at preferredpaincenter.com. I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.